Hi, this is Kimberly Knapp. This is the first part of my exam for my final history and physical exam for Nursing 502. So I'm just going to start by introducing myself to my patient today. Hi, I'm Kim. I'm a nurse practitioner student here to do your history.
Hello.
Can you tell me your full name?
It's Andrew Michael Knapp. It's K-N-A-P-P.
Date of birth, Andrew?
6/24/88.
And so how old are you today?
25 years old.
And your sex?
Male.
And are you married?
Yes, I am.
For how long?
A year now.
And do you have any children?
No.
And what's your occupation, Andrew?
I'm a Pennsylvania State Trooper.
Do you have any complaints as to why you're here today? I mean, are you feeling ill or injured?
No. I have actually no complaints. I'm just here for a checkup.
Okay. Andrew, do you take any medications on a daily basis?
Prescription-wise, no. I do take a multivitamin once a day, every day.
Okay. Very good. And do you have any drug or food allergies
No, I
that
do
you're
not.
aware of? And do you drink alcohol?
I do drink, and if I'd probably say approximately 2 beers a week. More of a social drinker.
What about tobacco products, smoking cigarettes, chewing tobacco,
Oh no, that's disgusting.
and any illegal drug usage?
No.
And as far as you can recall, to the best of your ability, are all your childhood vaccines up to date? Did you receive like your tetanus, polio, Hep B at birth and when you were a child?
Yes.
Okay. And do you receive a yearly flu shot?
Yes, I actually got it in October
Okay, great.
of this year.
And do you receive any yearly physical exams?
Yes. Yes, I have.
Good. And what do they do any sort of tests with your exams?
Yes, usually I try to get, I always ask for blood tests just to be on the safe side, and every time it's always been positive.
Okay.
Everything's come back good.
So
actually.
nothing
No.
abnormal. Okay.
No.
Have you received the pneumococci or chickenpox vaccine?
No, I have not.
Okay. So it sounds like you're pretty up to date on your maintaining your health, which is good medically. Now we're just going to talk a little bit about your past medical history. Thinking back to your childhood, do you recall any illnesses that you had, any injuries?
I had chickenpox. I don't know if you count that.
Yes.
And I probably had chickenpox. I'd say 94. I know I was young because
Okay.
my sister got it, and then I got it immediately after her. So.
Okay. Anything else?
Does high school count?
It does, yeah.
Alright, yes then. I had a deviated septum and also a torn meniscus, and I believe it was in my right knee.
So do you have years for those injuries?
I'd probably say between probably 2002, 2006.
Okay. And those were sports related, you
Yes.
said? Okay.
Yeah.
Now, as an adult, any major illnesses?
The only thing that comes to mind is I did have shingles,
Okay.
and I'd say that was in 2010.
Okay. So other than that, nothing. Pretty healthy.
Yeah, I mean I did have surgeries on. I don't know if
Oh,
that
you
counts.
had surgeries. Okay, yep. So where we're heading next, your past surgeries. So go ahead.
I had my deviated septum fixed,
Okay.
and that was in 2000. I'd say 2006.
Okay.
And then I also had my knee worked on. My
Okay.
torn meniscus in 2008, I believe it was.
Okay. Okay, got that. And any past psychiatric history that you were
No.
treated for?
No.
Okay, so now we're just going to talk a little bit about your family history. This includes just immediate family, so mom, dad, brothers, sisters, and then immediate grandparents. So first of all, are they all still alive?
Yes, they are.
Okay. So your father, any illnesses for him?
Yes, he has high blood pressure.
And your mother?
She, as far as I know, she's healthy. She's lost a lot of weight. She's running now. She's healthy.
Okay. And do you have any brothers or sisters?
Yes, I have a sister, and as far as I know, she doesn't have any problems medically either.
Okay. Now your dad's parents, so your grandparents on your dad's side.
Alright, my grandmother has Alzheimer's. Good, butchered that there. And my grandfather has type 2 diabetes.
Okay. And then your mom's parents?
Starting with my grandmother again, she has emphysema. And then also, I don't want to butcher it, so I'm going to explain it to you, and then you can probably tell me what it is. She lost part of her vision. She sees everything on her peripheral, but anything head on, she cannot. I guess it's blurry.
Yep. Probably macular degeneration. Yeah. Okay.
Yeah, that's what it is. Yeah, she has that.
Okay.
And then my grandfather, the only thing I can really think of is he had double. Trying to think what it's called. He had heart failure.
Heart failure.
Yes.
Congestive heart failure.
Yes.
Okay.
Yes.
Okay. Got
And
that all down.
other than that, he swims. He's active. Works
That's
still.
awesome.
So.
Great. Okay, so now we're just going to talk a little bit about your personal and social life. So can you tell me who you live with?
Yeah, I live with my wife, my golden retriever, and 2 cats in the townhouse.
Okay. And you said no children. And then you said that you work as a state trooper?
Yes.
Okay. So would you say that job is stressful or dangerous at all?
Yeah. The shifts, we work double backs every week, which is, it's only 8 hours in between an 8-hour shift. And we have 8-day stretches. It changes all the time. We go from days to nights, back to days within a 3-day stretch. I work an hour and a half away, so that adds to the stress of the lack of sleep, and then also the actual job itself, never knowing what you're going to get into, and just dealing with the stress of everything is very stressful.
So what would you say you'd like to do to relieve your stress of your job?
I work out, and I take my dog for a walk.
So you exercise. How often? What do you do?
I try 3 to 4 days a week.
Okay.
And I try to mix it up. I try to do cardio and weights.
Okay. And would you say you have a strong support system in your home and your life?
Yes, most definitely. My wife is my rock. She's definitely the most support. And my parents, and then I have a network of friends that are very supportive also.
Okay, so can you tell me a little bit more about becoming a state trooper? Did you have to go to college for this, or what did you do?
Yeah, it's a combination. You have to have at least an associate's degree, which is what I had, which I have, and I have it in police science. And then I also, to become a state trooper, you have to go through an academy, which is 6 months long, and it's very physical. It's pretty much like going to college, and then also trying out for a sports team. It's pretty intense, and it's a 6-month period.
Okay. But overall, you feel positive about life?
Oh, yes.
Okay. Do you follow a religion?
Yeah, I'm Christian.
Okay. And kind of a silly question, but do you have any issues with tying your shoes, brushing your hair, putting clothes on, feeding yourself?
No.
Okay. And what kind of diet do you follow?
It's difficult being a police officer. We try to eat on the go again, and
Right.
people do drop donuts off, but I try to stay away from that stuff. I try to eat whole grains. I try to eat lean meats instead of getting the cheaper meats that have the fat on it. I try to stick to fruits, vegetables. I'm actually into a dry fruit thing right now. I'm really eating a lot of dry fruit.
Do you drink any caffeinated beverages?
Yes, unfortunately, I do. I try to stick to at least only 2 coffees a day.
Okay. What about water? Do you feel like you drink enough water? How much water do you drink?
Yeah, I bring a gallon of water to work every day, and I try to drink as much of it as I can.
Okay. And then lastly, with you working in a dangerous job, do you feel like you take proper safety measures in your job?
Yeah.
To ensure your safety?
Yeah, the department gives us a bulletproof vest,
Okay.
and I wear that every time I'm on duty, and I wear it all the way up until I'm getting ready to leave the building, because you never know what could happen.
Mm-hmm.
I always wear my seatbelt to save lives, and my wife's not too she's very skeptical of the guns. She doesn't like guns in the house, so I always try to keep them locked, and I always leave them unloaded.
Okay. And then, when you're out in the sunlight in like the summer, do you use any skin protection?
Yes, I usually stick to SPF 45,
Okay.
250.
Okay. All right. Well, we're gonna move along here. The next portion of this history, we're just gonna review some systems of your body. So I'm gonna ask you a bunch of questions. Most of them have yes or no answers.
All right.
But some of them you will have to elaborate a little bit. Okay, so we're just gonna start with overall. Have you noticed any recent changes in your weight?
No.
Any weakness? Are you tired a lot?
No.
Any fever, chills?
No.
Have you traveled anywhere recently or been around anybody sick?
No.
Okay, now referring to your skin, have you noticed any new rashes, lumps, bumps, changes in the color, the texture, dryness, itching?
I'd say no. I did just recently get a tattoo. I mean, the healing process is going well.
Okay, do you put anything on it to help
Yeah.
it heal?
Yeah, I try to keep some kind of a moisturizer on it, some kind of lotion. Or there for a while, I was putting like A&E ointment. So.
Okay. Good. Okay. Now we're gonna move to your head area. Are you having any headaches? Have you had recent trauma to your head? Do you feel dizzy or lightheaded? Noticed any visual changes or pain in your head?
No.
Do you see an ophthalmologist for eye exams?
Yes.
Okay.
That's once a year.
Once a year. Good. And do you wear any corrective lenses?
Yeah, I have contacts and glasses.
Okay. But with your lenses, what do you feel like your vision?
20/20.
No blurriness. Okay. And no other issues with your vision? You don't see spots?
No.
Okay. Any changes to your hearing? So hearing loss, ringing in your ears, feeling like you're kind of losing your balance, anything like that? Pain?
No.
Okay. Have you had frequent colds, nasal stuffiness, itching of your nose, allergies, sneezing, anything like that?
No.
Nosebleeds?
No.
Okay. Any bleeding of your gums or mouth or a sore throat?
No.
And are your teeth all there?
Yes.
Okay. And any issues with your teeth? Do you see a dentist?
Yeah, I see you twice a year.
Okay.
Every 6 months.
Okay. And then your neck. Any swelling or pain, lumps in your neck?
No.
Your breast. Any lumps or pain or discharge from your nipples?
No.
Your lungs. Do you have a cough? Feel short of breath? Are you coughing up any sputum or
No.
sputum?
Phlegm?
Any phlegm? Yes, thank
No.
you. And no bloody phlegm.
No.
Okay. And do you have you had a chest X-ray anytime recently, or do you recall?
Not that I know.
Okay. And no asthma,
No.
pneumonias. Okay. Your heart. High blood pressure. Any like fast beatings of your heart where you feel like it's racing or skipping a beat?
No palpitations.
Any chest pain?
No.
Pain with like exerting yourself at all? Okay. And no pain at night specifically in your chest?
No.
And have you had any like cardiac tests done for your heart at all?
No.
Okay, now down to your belly. Any issues with like swallowing food or heartburn, changes in your appetite, nausea, vomiting? Any changes in your bowel habits, like the frequency of having bowel movements, pain with bowel movements, change in the color of them or consistency?
No.
Any bleeding with pooping?
No.
Any black or tarry poop?
No.
Hemorrhoids, constipation, diarrhea?
No.
And any general abdominal pain that you feel?
No.
Okay. Any yellowing of your skin?
No.
Okay. And no history of hepatitis, issues with your gallbladder, pancreas, spleen, appendix.
Nope, all looking good.
Now, talking about like your arms and your legs, have you noticed any pain specifically in those spots?
No.
Okay. And no blood clots?
No, not that I know
Okay.
of.
Right. No swelling in your feet?
No.
Okay. And changes in colors of your fingers and toes?
No.
And no pain or anything in your fingers and toes? Okay.
No.
Now, referring to your peeing habits, have you noticed any changes in that? Increased urination, peeing at night in the bed, an increased urgency to pee,
No.
burning, pain?
No burning.
Okay. And no blood in your urine?
Nope.
No UTIs, kidney pain in your back, right here?
No.
Kidney stones?
No.
And what does your normal urine look like?
I say, if I drink a whole gallon that day, it's clear.
Good.
But that yellow to clear.
Okay, great. Referring to your genitalia, your penis and your testicles, do you have any hernias, any sores or discharge from your penis, any masses in your testicles?
No, I do check my testicles
Oh, good.
once. It's usually the first Monday of every month.
Good.
I try to keep a consistent schedule so that way. But no, nothing.
Good. And any history of any sexually transmitted diseases, including HIV?
No.
And any changes in your sexual habits or life?
No.
I'm talking about like all your muscles and your bones. Have you noticed any pain in any joint, muscle, stiffness, arthritis?
No, not other than getting old. Other than that, no.
But nothing that you're
No.
concerned about. Okay. And you're able to move everything. Okay.
Oh yeah.
Okay. As far as psychiatric, so your mental health, do you ever feel nervous? Have like a lot of anxiety, changes in your mood all of a sudden?
No.
Memory loss, suicidal thoughts? And along those lines as well, any trouble with speech or ability to pay attention?
No.
Any changes in your memory?
No.
And then we already talked about headaches, dizziness, all that. Any numbness in your hands, tingling sensation?
No.
Okay. And you have never had seizures?
No.
Any bruising of your skin or easy bleeding from any area of your skin?
No.
And then lastly, any issues with your thyroid, which is right here, or inability to tolerate hot or cold temperatures?
No.
Any excessive sweating, thirst, or hunger? And then any changes in glove or shoe size?
No.
Okay, well that concludes our history portion of this exam. We're going to take a little break and then we're going to get our physical exam set up. So we're going to have you go get changed and ready for that.
All right.
And I'll meet you back in the exam room, okay?
Sounds good.
Thank you.